Good afternoon, everyone. Welcome to our LAMP webinars, episode 19. And let's start with the first topic. We are still on the 5 elements, part 3. So the 5 element theory generating sequence, pinapakita dito how balance is achieved in nature and how every element is connected, no? And depends on each other for balance. So all the elements in the generating sequence should be balanced, and each of these elements is connected to each other. Okay, we need wood. Kailangan natin ng wood to grow a fire. Okay, and the heat which is coming from the sun will help grow food and plants. Earth grows soil full of minerals, okay? And metal or minerals will enrich water with iron, magnesium, and potassium. Water provides growth for the trees and plants to flourish. Okay. Within our bodies, each system depends on each other to stay healthy and reach optimum health, which we call homeostasis. No? So the liver relaxes the body for better flow and to manage stress. The heart provides a calm mind for better sleep. And the spleen transforms nutrients for better digestion, and the lung defends the body for a healthy immune system. And lastly, the kidney will hold our DNA for healthy reproduction and growth. Ma'am Mildred, would you like to continue?
Yes po, Doc.
Okay po.
Nasaan ka na, Doc? Reproduction and growth. If one is out of balance, it can trigger a chain reaction like this one. When a woman is experiencing high stress levels, she may be anxious and cannot sleep, which affect her choice of food to keep her energy up during the day. Coffee, sugar, junk foods. Her diet doesn't feed her immune system and she will catch cold and flush more often. If she's trying to conceive, she may experience difficulties as her low immune function can result in early pregnancy loss. Miscarriage put a lot of physical stress on the body and mind, making her frustrated and angry. When treating patient, it's key to figure out which elements was affected first to make the proper treatment plan and address the root. Ayun po. So kung titingnan po natin itong pagkakasunod-sunod niya, so nagsimula siya sa stress. Pagkatapos ng stress, siyang cycle po to from the wood, in-affect niya ang fire, ang heart, then in-affect niya ang earth, spleen, then affected yung metal, andun yung lungs, then lungs to kidney. So po, ganun po ang nangyari. So the 5 elements general generating sequence. So, mula po sa water, magsimula tayo dito sa water. Water grows wood, siyempre. Pag diniligan mo yung puno, magiging malusog, nagiging wood. Then si wood, pinapanggatong. Nag-create ng fire. Then si fire, magkakaroon ng acid, sun is needed to grow earth food. Ayan po. Then, si earth provides soil, high in minerals. Then metal, nagkakaroon po ng mineral metal enriches water. So, ganun po yung cycle niya. Yan. Element cycle, generating cycle. So, magsimula po ulit tayo sa wood, si kidney and bladder. So, pag may fertility issue, leads to stress, affect niya si liver and gallbladder. There's si liver and gallbladder, stress can lead to insomnia, hindi siya makakatulog. Affected si heart and small intestine. Insomnia leads to craving due to fatigue. So affect niya si spleen and stomach. Then si spleen and stomach, nagkakaroon ng bad diet, leads to poor immune system. Yan. I-affect niya si lungs and large intestine. So pag napek na silang sa large intestine, depleted immune function can lead to infertility issue. Yun, babalik ulit po yung cycle na ganun. So yan po yung out of balance cycle. Generating cycle. So yung summarize po ng ating 5 elements. So from wood, spring, green, wind, yung kanyang ano po, tapos anger ang emotion, liver and gallbladder ang organ, sinew and tendons, siya po yung namamahala doon, at sa eyes and nails. Yung si wood, ang color niya is green. Then si fire, so yung cycle po ito ano, si fire, summer po ang kanyang, ano nga to, climate. Color red, heat, joy, so organ, heart and small intestine, blood vessel, tongue, siya ang nagmamahala sa tongue at saka sa ating complexion. Then sa earth, late summer, ang color niya ay yellow, climate niya ay damp, emotion, pervasiveness, worry, organ, spleen, stomach, namamala sa flesh, muscle, mouth, and lips. Kaya pag may problem po yan, so ito may pananagutan doon. Then si metal, autumn, color niya white, dryness, ang kanyang climate, so emotion, grief, sadness, organ is lung and large intestine, siya ang namamahala sa ating skin, nose, and body hair. Si water naman, winter, blue, black ang color, cold, emotion, fear, organ is kidney and bladder, bone and bone marrow, ano may namamahalaan niya, ears and head of the hair. So, yun po yung summary ng ating 5 elements function. Tsaka climate, ayan po, mas na-summarize dito. So, yung elements po, pag in organ, si liver, wood, si heart, fire, si spleen, earth, silang metal, kidney, water. Yung organs, ang partner organ niya ay si gallbladder, small intestine sa fire, stomach sa earth, large intestine sa metal, and bladder, water. Ang season po ay spring, summer, between season, fall, winter. Colors, green, red, yellow, white, black. Senses, eyes, tongue, lips, mouth, nose, and ears. So maganda po itong i-ano natin, i-print. Tissues, sinews sa liver, vessels sa heart, muscles sa spleen, skin sa lungs, and kidney, bones. Ang taste ay, ang liver sour, ang heart ay bitter, spleen is sweet, lungs pungent, and kidney salty. Emotion is anger sa liver, joy sa heart, worry and overthinking sa spleen, lung sadness, and kidney shock. Sa weather naman po, ito yung siyempre yung weather niya ay wind, winter, tapos to summer. Si spleen ay damp or rainy season. Si lungs ay dry. Tapos si kidney ay cold. Ayan po yung mga summary. Mahalaga po yan na alam natin na nasa sa ulo. Okay po, maraming salamat po.
Thank you very much, Ma'am Mildred. Do we have any questions? Napaka-basic po yun. And as a practitioner, we should be able to have mastered already the 5 elements theory. And pati yung mga correspondences, no? Which can be very, very helpful in our assessment of the patient.
Opo, foundation po kasi yun eh. Dapat talaga alam natin kasi kung hindi natin alam yung foundation, mahihirapan tayo mag-diagnose.
Totoo po yun. Okay, so while wala pa si Ma'am Teresita, I'll take over. Thank you po. We will now proceed to tongue diagnosis. The topic is if you have a patient na may feeling of pressure and pain under the ribs. The symptom alone can already tell us ano yung problem ng patient or what to expect to see on the tongue, no? So, si Mrs. S, change na yung diet niya according to the principles of the 5 elements. Sabi niya, meron siyang spleen qi deficiency. So nag-self-prescribe siya a diet of hot spicy foods. No? After 3 months of the diet, she suddenly experienced uncomfortable pressure under the ribs that was worse on the right side. No? The pain was occasionally quite strong, malala sa gabi, and sometimes nagigising siya in the early morning. From ovulation until the onset of menstruation, yung intensity ng pain nag-increase. During this time, she also suffered from painful, distended breasts. After meals, Mrs. S often experienced a heavy or full feeling in her abdomen. Nag-change ang stools niya from being dry and pellet-like, naging loose po. Mrs. S worked 40 hours a week and studied at night, so super busy. She often felt tired and overstretched from too many demands, as well as emotionally imbalanced. So over the past 12 months, the dentist diagnosed na meron na po siyang onset of periodontitis. No? The tongue body color was normal, pero yung center ng tongue was red, dry, and slightly cracked. Her pulse was thin, slightly wiry. Now, analysis. Yung daily consumption niya of hot and spicy foods, ito yung nagbigay ng heat in the stomach. So we can see it in the red, dry center of the tongue. You see that, no? Because of the demands at work and her constant tiredness during the day, the patient consumed a lot of black tea and coffee. So nakapag-contribute po ito ng heat. So this led to slight deficiency of fluids in the stomach. Alam niyo naman effect ng heat. So this case of early stage stomach indeficiency, nagmanifest po sa tongue as small cracks in the center. So tingnan niyo yung mga dila niyo, baka nakaka-relate po kayo, no? So nawawaksi na po yung coating dahan-dahan. So yung stomach indeficiency plus yung heat in the stomach were responsible for the inflamed gums. No? Kaya na-diagnose siya to have periodontitis ng dentist niya. Yung different demands sa life niya led to liver qi constraint or liver qi stagnation. So the uneven flow of liver qi nagmanifest ito as pain and a sensation of pressure under the ribs, plus increased pain during her menstrual cycle. Tapos nagbago yung consistency ng stools niya, no? And also painful na yung breasts, pati wiry pulse. These are all signs of liver qi constraint. Okay? Yung upward and downward directed actions ng stomach qi were also impaired by the constrained liver qi. This is very true, no? If you have liver qi stagnation, liver qi constraint, this will affect the stomach qi, no? So nagkaroon po siya ng sensation, and we can see this because meron po siyang sensation of epigastric fullness after meals. Okay? Pain under the ribs na nagwo-worsen sa gabi may be due to the constraint of qi or qi stagnation, which gets worse when one is passive pero nag-i-improve with movement. So that's very qi stagnation. So the goals of treatment were to spread the liver qi, kasi dito po nagmula lahat, clear the heat from the stomach, and nourish the stomach in. Mrs. S changed her diet. She started to eat fruit, especially pears. Nag-abstain na siya from spicy foods. She was also treated for 6 months with acupuncture and Chinese herbs. So ito po yung ginamit na points, no? Pericardium 6, neutral, liver 3. I think you're very good at this. I always combine liver 3 with gallbladder 41. Very effective po, no? And then, neutral, yung liver 3, but for gallbladder 41, you have to drain it. Triple burner 6, this is very good for constipation, for stools, no? Draining, that means sedation. Stomach 44 for the stomach fire, draining. Stomach 34, draining. Stomach 36, tonification. Spleen 3 to improve the spleen function, tonification. Treatment was supported with Chinese herbs. Over a period of 3 months, the patient took a decoction of minor blueplurum decoction. Nag-improve yung symptoms niya considerably. Seldom lang siya nag-experience ng pain. However, yung demands ng work niya and emotional problems still had a tendency to trigger the pains under her ribs. So these are the things that you really have to consider. Especially, this reminds me of a patient, no? Meron kasi silang restaurant, both husband and wife. They have the same problem. May GERD sila. And I noticed that napaka-swollen ng tongue, but very peculiar po yung liver, no? Liver qi constraint, liver qi stagnation. So this can trigger the pain under the ribs. The tongue nag-resume yung its normal shape. Hindi na po red yung center ng tongue. And you will clearly see na nagdi-diminish po yung lalim ng cracks, no? So what does this signify? Nag-regenerate po yung fluids and in the stomach. Okay, nakakatuwa, di ba? And nawala din yung wiry quality ng pulse. Okay? So here you could really see the comparison before and after treatment. See? Thank you very much. Any questions?
Point, Doc, yung ginamit mo na very effective.
Opo. Yung mga points. Actually, very common po yan no? Super common. In fact, gagayahin ko nga
Effective po talaga siya, madaling gamitin.
Para saan po yung di ba, na stomach 34. Anyway. Thank you very much for listening. I hope you find this very useful. No? We will now proceed to diagnosis by interrogation. We have Ma'am Mildred once again. Pagsama na. Si Ma'am hindi rin pwede kasi andun pa siya sa medical mission. Wala daw signal doon. So Ma'am Mildred will take over for feeling of cold. Namatay kasi yung cousin din ni ni Ma'am Vina. So nasa sila. Okay.
Feeling of cold. Why we ask? Question about a feeling of cold or heat and fever are generally asked towards the end of the interrogation to establish the hot or cold nature of a pattern. Why we ask? We should always ask all our patients about feeling of cold or heat. The clinical significance, however, varies in internal and external condition. In internal condition, which constitute the overwhelming majority of most practices, the distinction between feeling of cold and feeling of heat simply tells us about the cold or hot nature of prevailing patterns. In external condition, example, when a patient presents with an acute cold or influenza, questions about feeling of cold or heat are needed primarily to establish first of all whether it is indeed an external condition and whether the pathogenic factor is in exterior or interior. So yun po yung mahalaga, kaya tinatanong natin. The patient cold or hot feeling should never be discounted, even when it contradicts the tongue and or false. For example, a patient may have a clearly red tongue but always feel cold. Although the sign of a red tongue is very important, we should not discount the cold feeling and should investigate further to find the cause of this discrepancy. Yun. Kaya hahawakan na rin natin ang pulse pag ganun po. Titingnan natin. When we ask, as mentioned above, question about feelings of cold and heat should always be asked routinely in all patients. An internal conditions question about a patient feeling cold or hot are often asked toward the end of the consultation to confirm the existing of a cold or hot pattern. Open questions about feeling of cold or heat also help detect the constitutional tendency of a patient to cold or hot condition. For example, a patient may have significant symptom of yang deficiency and cold, but on asking may say she always feel colds, needs to wear more clothes than other people, etc. These symptoms should never be discounted because it indicates an underlying tendency to yang deficiency and cold patterns. So, dun po pag tinatanong natin yon, siyempre nakita na natin yung tang dyan eh. Parang kino-confirm natin habang ine-interrogate natin, ano natin na, kung nakikita natin sa tang, i-clarify natin sa ating mga question. In external condition, question about feeling of cold and heat are crucial and should always be asked in detail to establish whether the pathogenic factor has gone into the interior or whether it is still in the exterior. So, yun. Kaya minsan po, di ba, tinatanong natin, ang pakiramdam po ba nyo nilalamig, tapos pakiramdam din na mainit, yung chills and fever. So, kasi pag chills and fever, alam natin na sa exterior pa. Lumalaban pa lang yung ating yang and if we see a patient every day in course of an acute exterior condition we should carefully ask about feeling of cold and heat every day to establish the exterior or interior nature of a pattern. Kung naalala po natin doon sa yin and yang, di ba? Pag nasa exterior pa lang, tumataas pareho yung yin and yang. So, andun yung feeling nila na parang chills and fever. How we ask. In China, the question about feeling of cold and feeling of heat coincide almost exactly with the terminology of Chinese medicine, which make it very easy for Chinese doctors. With Western patients, it is a little more difficult, and we need to make sure we ask patients about feelings of cold and heat in a way they can readily understand. So, pag nagtanong po tayo, parang kailangan mong i-paraphrase na maunawaan nila yung tanong mo. In interior condition, for feeling of cold, we should simply ask, do you feel cold in general? Do you have a tendency to feel cold? Pag sinimplify po natin yan, madali ka bang lamigin? Yung parang ganon. Or do you notice that you feel colder than other people? Mas lamigin ka po ba? Konting hangin lang, nilalamig ka. Yung parang gano'n po ang mga tanong. Madali nilang sagutin. For feelings of heat, we should ask questions such as, would you say you feel hot or in general? So, mas kailangan pong isimplify yun na maintindihan nila. Do you sometimes feel usually hot? Madali po ba kayong makaramdam na mainit ang katawan? Parang gano'n. Or do you want to open the window when everyone else want? Mas gusto nyo laging bukas yung bintana, samantalang yung iba, ayaw nilang bukas, pero ikaw gusto mo laging bukas. Or it close. If the patient answer affirmatively to one of the above question about feelings of heat, we should go on to ask more specifically about when he tends to feel hot in order to establish whether it is full or empty. Empty heat. We therefore ask questions such as, do you tend to feel hotter in the afternoon or evening? Kasi pag alam natin na mas sa gabi sila nakakaramdam ng init, so alam natin na yin deficient yun.
Okay, maraming salamat.
Salamat po.
Mildred. Mamaya ikaw pa rin sa PCM. sa ano. Okay.
Po.
Thank you very much. Okay, we're very happy na dito na ulit si Sir Dino. So I'm sure excited na siya. Any questions before we proceed? Okay, wala po. Let's proceed. We will now give you Sir Dino straight from Legazpi. Good afternoon, Sir Dino.
Good afternoon, Doc. Good afternoon, classmates. Okay. Topic natin today, stagnant pulse. Okay. The stagnant pulse feels reluctant to come, as if being suppressed, and seems unlikely to last. It does not flow smoothly and does not have a wave. So yan ang stagnant pulse. Sa combination, the stagnant pulse nearly always indicates dips, emotional problems. So madalas po ito sa emotional problems, pent-up feelings, resentment, and depression. It also appears when the patient is on certain drugs, especially sa tranquilizers. So nakikita din po yung stagnant pulse. Sa combination naman, stagnant weak indicates severe emotional problems occurring against a background of Qi and blood deficiency. Sa stagnant choppy naman indicates severe emotional problems occurring against a background of heart blood deficiency. Yung patient is usually very depressed. So, yan ang stagnant choppy. Sa stagnant full indicates pent-up emotion, bottled up resentment, and depression occurring against a background of liver Qi stagnation. Kaya stagnant pulse po siya. Sa differentiation of similar pulses, sa choppy, the choppy pulse lacks a wave and is weak and empty by definition. Samantalang stagnant pulse also lacks a wave, but in addition, it feels reluctant to come. Parang ayaw niyang, parang hirap lumabas. And as if being suppressed. Sa SAD naman, like the stagnant pulse lacks a wave, but it is also short, which the stagnant pulse is not. So, yun po ang difference. Sa clinical significance in its position, sa front position, heart and or lung Qi stagnation from sadness, grief, or depression. Sa middle position, liver Qi stagnation from pent-up anger or resentment, tranquilizers. Sa rear position, Qi stagnation in the intestine. So, thank you po.
Thank you very much, Sir Dino. Do we have any questions? Okay, so tuloy-tuloy tayo. We're going to proceed now to differential diagnosis. Mahina po ang signal ni Ma'am Nit, so we are going to take over. The topic is very easy. Large intestine in deficiency with dryness. Okay. Etiology. Pag meron po tayong large intestine in deficiency with dryness, usually this is caused by lack of blood and body fluids with underlying blood or insufficiency that lead to exhaustion of fluids in the large intestine. Another cause is warm, dry climate. Uso po yan ngayon. Postpartum blood deficiency, especially kung yung panganganak ng isang babae masyadong traumatic, masyadong maraming bleeding, no? Affected din po si large intestine. Liquid depletion in the aged, kaya dapat meron po tayong baon tubig always. And wag magpapainit, kailangan kung nahihilo na dahil sa init, kailangan magpayong o wag na lumabas, no? And also in enduring and severe diseases. Kaya 'di ba parang nangunguluntoy. And kung meron din tayong externally contracted febrile disease. So ano po yung signs and symptoms ng LI in deficiency with dryness? Of course, if you look at the stools, dry po siya and matigas, which are difficult to move, no? Meron siyang dry mouth and throat, usually payatin, thin body, may bad breath, because affected din yung stomach, no? Dizziness, generally no abdominal distension or pain. So wala po siyang abdominal distension or pain. So this could be a red flag already. The pulse is masyadong fine, masyadong fino. Kasi nga meron pong yin deficiency. So dito po natin makikita sa tongue. So wala pong coating, no? Dry and peeled. Pwede rin siyang pale or red. So it's either pale or red. Kasi pag ano pa lang po siya, yin deficiency ng large intestine, it doesn't necessarily have to be red. Kailangan may dryness, may heat. So treatment principle, what do? We have to supplement the yin, of course, kasi nga deficient ang yin. Promote fluids, regulate intestines, move stagnation. Andyan yung ating favorite, stomach 36. This can promote yang ming fluids. And of course, yung kanyang katambal, spleen 6. This can supplement the yin and promote fluids as well. Okay? And when remember, when you use spleen 6, you actually hit 3 organs already. The kidney yin, the liver yin, and the spleen yin. Kidney 6, this is a very favorite kidney point for supplementing the yin and also promote the fluids. No? Ren 4, this is very yin. Kaya it can promote fluids. Stomach 25, to regulate the intestines. Now, bladder 17, to harmonize stomach chi. Kasi may kinalaman po ang stomach sa of course, stomach and spleen to produce blood, diba? Bladder 20, bakshu of the spleen, to benefit spleen transformation. And of course, bladder 21, the bakshu of the stomach, to support the center chi to supplement deficiency. We can also add bladder 25 to regulate the large intestine and to transform stagnation. Okay, needling would be tonification or supplementation, and maybe moxa if needed. So I think we only do moxa if there is dampness, no? But I don't think moxa would be a very practical approach here kasi nga dry na. Okay. So maraming salamat po. That would be all. Any questions? So we just tried to study Li yin deficiency with dryness, no? Okay, kasi pag sinabi nating yin deficiency, peeled na po ang coating. No? Pwedeng red, pwedeng pale. Thank you very much. Mukhang tahimik tayo. We will now proceed to acupuncture patterns and practice, and we have the very ever reliable Sir Dino Pinero again for cough. Ngayon, uso na po yan. Good afternoon ulit, Sir Dino.
Good afternoon, Doc. Good afternoon, classmates. Today, ang topic natin sa cough, etiology and pathology. Ito, may two principal types of causes, exogenous and endogenous. Sa exogenous cough is due to attack by an exogenous pathogenic evil on the lung system. Most commonly, yung wind attacks first and is subsequently joined by cold, heat, dryness, or the others. Attack on the lung system disturb the dispersing and descending action of the lung qi, and the lung qi ascend abnormally, causing illness. So yung pababa na function ng lungs, instead of going down, pa-ascend po siya. Thus, exogenous cough is a condition of strength of exogenous evil. If the exogenous evil cannot be removed promptly, there may be a further development or complication, such as wind cold transforming into heat, wind heat transforming into dryness, or lung heat transforming the normal fluids into pathogenic phlegm. Sa endogenous cough naman is due to internal injury disturbing the function of the sangfu organs and causing disordered dispersion and abnormal rise of lung qi. The internal injury may result from a variety of causes. It may be due to overstimulation by the passion, so the liver qi becomes stagnant and transformed into fire. The liver qi and the fire then move upward along the pathways of the meridian and attack the lung. It may be due to intemperate diet, with excessive spices, fats, alcohol, or smoking burning the stomach and the lungs. It may be due to impaired transportation by the spleen, so the turbid phlegm arises and endogenously and permeates the lung. It may be due to deficiency of both kidney qi and kidney essence brought about by the excessive fatigue or sexual indulgence, so that the yin is injured and the qi exhausted. And this leads to impairment of the lung's ability to govern qi. Similarly, sa chronic illness may bring about insufficiency of the lung with injury to the yin and exhaustion of qi. Whether the cough is exogenous or endogenous, the pathological mechanism is injury to the lung system, with disturbance of its dispersion and purifying function. This injury being mediated mainly by phlegm and fire. Prolonged exogenous cough can transform into internal injury. Endogenous cough generally results from the weakening of the lung and the defensive level. It is also readily induced or aggravated by exogenous evils attacking when the body is in a weakened state. So kung mahina ang katawan, yung external po ang nag-a-attack, papasok. Sa clinical manifestation, cough is a symptom. In general, exogenous cough has a rapid onset and a short course. Sa endogenous cough naman tends to have a more prolonged course and is often accompanied by symptoms of injured visceral organs. So internal po yun. The characteristics of the most common illness with cough are listed here. So sa exogenous cough, wind cold attacking the lungs, cough with throat itch, thin and white sputum, nasal mucosal congestion with clear discharge, or cold aversion, fever, headache, and body aches. The pulse is floating and tight, and the tongue coating is thin and white. Pag wind heat attacking the lungs naman, frequent and intense cough with viscous and yellow sputum that is difficult to expectorate. So dahil sa heat, may yellow sputum. Thick yellow nasal discharge, thirst, or fever. The tongue is red with thin yellow coating and the pus is floating and rapid. So wind heat attacking the lungs. Next is dryness attacking the lungs. Cough without sputum or with slight viscous sputum that is difficult to expectorate, or blood-streaked sputum and the dry lips and nose with strong thirst. The tongue is dry with thin white or thin yellow coating and the pus is floating and tight or floating and rapid. Next is endogenous cough. We have the liver fire attacking the lungs. Paroxysmal cough with its spell difficult to stop with thick sputum in the throat that is very difficult to expectorate. Meron siyang flash face with dry throat, chest and subcostal pressure and pain, and a dry mouth with a bitter taste. Yung tongue coating is thin, yellow, and dry, and the pus is stout and rapid. Sa phlegm dampness accumulating in the lungs, merong recurrent cough with much viscous white or gray sputum that is easy to expectorate. Mas madali po siyang ilabas. The cough stop when the sputum is expectorated. Meron siyang hoarse voice, chest and epigastric tightness, anorexia, and tiredness. The tongue coating is white and greasy, and the pulse is soft and slippery. Sa phlegm heat blocking the lungs naman, cough with heavy breathing, copious sputum that is viscid and difficult to expectorate. Meron siyang flash face, dry mouth or fever. The tongue is red with yellow and greasy coating, and the pulse is slippery and rapid. Sa yin deficiency of the lungs, meron siyang dry cough without sputum or blood-streaked sputum. The cough is short but explosive or hoarse. Dry mouth and throat or low-grade fever or sometimes hotness in the 5 centers. The tongue is red with scanty coating and the pulse is thread-like and rapid. Next is Qi insufficiency. Cough with copious thin sputum, meron siyang shortness of breath, may weakness, and spontaneous sweating. Sa key points, yung sa endogenous versus exogenous, in general, exogenous cough arises as a new illness, yung external, with abrupt onset following exposure to cold and is accompanied by nasal mucosa congestion and discharge. Meron siyang sneezing, an itchy throat, distending headache, generalized body aches, aversion to wind or cold, and fever. Pag endogenous cough naman is generally chronic, with slow onset. There is usually a symptom of other visceral organs such as fatigue and weakness, chest, distension, flank pain, anorexia, diarrhea, and other symptoms. Thank you. Ang ganda lang po.
Yeah. Ipagpapatuloy ni Sir Dino yan tomorrow. Okay? Maraming salamat, Sir Dino. Do we have any questions? So at least alam na natin po ang difference ng exogenous cough from endogenous cough. Anyone who would like to comment, to share? Is there anyone here who could relate? Ay, andito na si Ma'am Teresita. Welcome back. May ilaw na sila.
Thank you, Father. Good afternoon.
Good afternoon. So baka ikaw na pwede sa asthma, Ma'am Teresita, no? Para hindi naman ma-stress si Ma'am. Okay. Let's now proceed to signs and symptoms. It's always good to see Sir Alvin back na kumukuha ng masters sa kanyang MPH, Public Health. Okay. Good afternoon, Sir Alvin.
Yes, Doc. Classmates, good afternoon po. So, we're going to talk about signs and symptoms, number 58, which titled Redness of the Throat. Okay, so here, the redness of the throat does not mean a redness inside the throat, pharynx, but rather a redness on the skin overlying the throat. So, pag ating pag may heart fire ang diagnose natin, usually yung mga signs and symptoms nito. Of course, mayroong redness of the throat that gets worse when patients talks, thirst, may bitter taste, may palpitation, anxiety, red face, red tongue, okay, with redder tip and yellow coating. Ang kanyang pulse ay overflowing. Okay. So kapag ang pattern naman na heart yin deficiency with empty heat, floating redness on the throat, ilan sa mga signs and symptoms, dry mouth and throat, palpitations, insomnia, dream disturbed sleep, poor memory because of heart yin deficiency. Meron din siyang anxiety, mental restlessness, a feeling of heat in the evening, color flash, night sweating, 5-pound heat. Ang tongue niya is red with redder tip without coating. So, ang kanyang pulse, floating empty and rapid. Okay, so pag ang pattern, lung heat, malalaman natin, meron siyang redness on the throat, dry throat, thirst, meron na siyang cough. Okay, pag lung heat, a slight breathlessness, feeling of heat, of course, chest ache, flaring of nostrils, red ang face, red ang tongue, with yellow coating, overflowing rapid naman ang pus. Alright, so kapag naman lung yin deficiency with empty heat ang pattern, ang kanyang red nose, floating redness on the throat, malar flash, dry cough, or with scanty. Sticky ang sputum, dry mouth, kasi nga lung yin, and throat at night. Mayroon siyang night sweating, redness, tiredness, a feeling of heat, or a low-grade fever in the evening. May 5-pound heat, thin ang body niya, mayroon siyang red tongue without coating. So, it's nga empty heat. So, floating empty and rapid ang pulse. Right? Kapag ang pattern naman or diagnosis natin is Libriang rising, mayroon siyang floating redness on the throat. May headache na siya and dizziness. May tinnitus, mayroon siyang irritability. Okay, so red ang face. And of course, wiry ang pulse. Kapag nasa liver fire na, ating diagnosis, red ang throat, redness on the throat, thirst, bitter taste, red face, irritability, propensity of outbursts of anger, may headache, constipation, dark in urine, ang tongue niya red with redder sides, and dry yellow coating, wiry rapid ang pulse. Okay, so clinical notes. I have noticed that redness on the skin over the throat that appears as the patient's talks indicates severe anxiety with heat or empty heat. Maraming ganitong tao. Alright? So, thank you so much for listening. Any questions so far?
Thank you, Sir
po.
Alvin. Thank you very much po. We will hear from you again tomorrow, hopefully. Okay. If there are no questions, proceed na po
Yes,
tayo sa last topic. Last but not the least, we are still on asthma. Let's call on Ma'am Teresita Sumile for the presentation. Good afternoon, Ma'am Teresita.
Good afternoon po, Dr. Hector and classmates. Early onset allergic asthma with Xiaochuan 4. Case history. A 42-year-old woman had been suffering from allergic asthma since childhood. The asthma had got better during adolescence, but after she was about 32, it worsened. At that time, the asthma started after an episode of influenza that then turned into bronchitis. She had 3 courses of antibiotics but was left with a cough productive of profuse sputum, wheezing, and breathlessness. She was prescribed inhalers of steroids and antagonist by Bricanyl. All these symptoms seem to point clearly to a late onset, like intrinsic non-allergic type of asthma. However, there were other factors that pointed also to an early onset, like intrinsic allergic type of asthma, that is, the period of allergic asthma during childhood. The onset of asthma attacks on exposure to dust, high levels of IgE, and the fact that she also suffered from allergic rhinitis. This case history is given here as a clear example of a case of asthma that is a mixture of allergic and non-allergic. In her case, although the asthma was originally of the allergic type, she did also have phlegm. Okay? Atopic eczema not discussed with allergic asthma in the theory of Xiao Chuan. The pathology of Xiao Chuan does not contemplate infantile eczema, which so often accompanies or precedes either early onset asthma. And yet the connection between eczema and early onset allergic asthma is very close and clinically extremely frequent. Chinese medical theory can easily explain this connection via the lungs, which are involved in breathing and control the skin. Strangely, this connection between lungs and skin does not seem to be used in the diagnosis and treatment of infantile eczema. The connection between asthma and eczema is also easily observed in the Wheeling reaction occurring on the skin of atomic individuals from inhalation of allergens. Okay? Summary. Differences between early onset allergic asthma and Xiao-Chuan pathology. Phlegm is central to the pathology of both Xiao and Chuan. Next, phlegm is not the main pathogenic factor in allergic asthma. In allergic asthma, wheezing and breathlessness are due to narrowing of the airways from bronchospasm following an allergic reaction, while the narrowed bronchial cannot be properly cleared of mucus by coughing. Phlegm is therefore the result rather than the cause of the condition. In early onset asthma, the tongue is not usually swollen. It is often thin, and the pulse not slippery. It is often tight. Therefore, pulse and tongue do not show phlegm. Okay? Another factor that rules out phlegm as a pathogenic factor in asthma is the fact that in between attacks, an asthmatic person is often quite normal. Indeed, there are some athletes who are asthmatic. If phlegm obstructs the lungs, however, wheezing and breathlessness are constant and they persist until phlegm is completely eliminated. The intermittent nature of the pathogenic factor confirms that this is wind rather than phlegm, as it is in the nature of wind to come and go and change rapidly, whereas phlegm would not have this intermittent nature. In chronic asthma, other factors account for the narrowing of the airways, that is, a swelling of the lining of the airways and the presence of mucus. The more chronic the asthma, the more these two factors play a role in the narrowing of the airways. The mucus that forms in the airways in allergic asthma is a consequence of the inflammatory reaction, which in itself is a consequence of the allergic reaction. Therefore, we can say that mucus is more the result than the cause of allergic asthma. The pathogenic factor in allergic asthma is wind, not exterior wind as such invading the lungs, nor interior wind, but a kind of chronic exterior wind lodged in the bronchi and periodically leading to bronchospasm. The attacks are elicited by exposure to allergens or cold weather or by emotional stress. The pathology of Xiaochuan does not contemplate infantile eczema, which so often accompanies or precedes only onset asthma. And yet, the connection between eczema and early onset allergic asthma is very close and clinically extremely frequent. Yun lang po. Thank you so much for listening.
Thank you very much, Ma'am Teresita. Do we have any questions? Okay. Wala po tayong Zoom tonight. Meron pong BOT meeting. So we will resume the 8 p.m. Zoom tomorrow and on Thursday. And we will have no Zoom next week in observance of the Lenten season. So bakasyon po tayo. Magdasal-dasal. And okay, any questions po? Thank you very much for joining, and especially the presenters. Tuloy-tuloy lang po tayo. We'll see you again tomorrow, same time. Thank you, everyone.
Thank
And
you, Doc.
Good evening po. Ingat sa mga hackers. Okay.
Thank you,
Kailangan
Doc.
mag-ingat sa atin.
Nga sa mga hackers.
Huwag kang magkaroon ng endogenous stuff.
Hinanap ko lang, hinanap ko saan ko ako papasok eh.
Hindi, okay lang yan. Kaya lang yan. Wag pa affecto.
Po yung para nahilo din siya.
Nahilo siya. Hanggang siya maiwan doon. Okay. Maraming salamat po. Nakatape po ito. Okay, bye-bye. Good evening, everyone. Thank you po. See you tomorrow. Bye-bye.
Bye-bye. God bless.
Bye, God bless.